Welcome to LifeChangers, a program designed to give solutions to the problems of daily living. My name is Dr. Kondur Abraham. I'm a clinical psychologist by profession. I've been doing radio broadcasting for 12 years and have just started with these television programs. I have with me Dr. Kumar Rajgopalan, who is a medical doctor, and I will be interviewing Dr. Kumar in this show. Just before we do that, I would like to read a letter that I got in response to one of my radio programs. This letter came from India, from Andhra Pradesh, and this lady wrote to me and said, I was greatly strengthened because I sat near the radio with a very dull heart, full of sorrow due to never-ending problems. It appears to me in that way, which I am undergoing through. Now I am writing this letter to you with so much happiness, for I was strengthened in my spirit. Dr. Kumar, this is a letter that came to me a while ago, and basically what she is saying is she was experiencing a lot of depression. And I do get letters like this in response to radio programs. And in your practice as a medical doctor, and of course I know you used to practice in India too, before you came to the United States, how often do you come across people who are severely depressed?
Depression is a fairly common disorder. It's a serious medical illness. It's not something that you've made up in your mind. It's something more than just feeling down in the dumps or feeling of blue. Mm-hmm. It is a disorder of the mood which affects our thought process, and it's a serious medical illness which is not uncommon throughout the world.
Now, do you see a lot more depressed people here in the West in comparison to India, where you used to practice and also had your medical training?
Yes, we do.
What could be the reason for such a high rate of depression?
Depression is a cultural factor which comes into play which causes depression.
What kind of cultural factors?
It's a socio-cultural disorder. In India, our bringing is entirely different. In the United States, depression is more common, especially genetic factors come into play. And there's also the socio-cultural life factors like poverty, divorce, drugs, alcohol. It's much more common in the United States than in India.
Let me ask you this. In India, we have a lot of people who are very poor. But, I mean, at least from my experience, not too many of them are very depressed to the degree that they have to be on medication.
You have a lot of parental support in India, which is lacking in the United States. All of us experience depression of some kind for a short period of time. Mm-hmm. Maybe some life circumstances like poverty, financial problems, divorce, separation. These are more prevalent in the United States than in India.
Okay. I know you had your training in India as well as in England, right?
Yes.
And then you also worked in Ireland for some time.
Yes, indeed.
So really you can compare between East and West. And again, that's not the reason for this program. Now, you talked about some of the major symptoms of depression. Like you said, every one of us experience depression to some degree, but then there is what is known as clinical depression with all these symptoms that you mentioned.
Exactly. See, clinical depression is a disorder of the mood for an extended period of time which lasts more than 6 months. Mm-hmm. All of us go through a short period of depression at some point in our lives. But clinical depression is something which is more persistent. There's loss of guilt, worthlessness, helplessness, hopelessness, pessimism, thought of death, suicide, anger, frustration. These are some of the symptoms of clinical depression.
Yeah, that's a big list. Feelings of hopelessness, worthlessness,
guilt, pessimism,
guilt. Okay. All right.
Anger, frustration.
Anger and frustration.
And some calamities or tragedies in the family, like loss of a loved one, a breakup in a relationship,
Right.
and also clinical diseases like chronic illnesses like diabetes, cancer, Parkinson's disease, strokes, also contribute to a trigger in the cause of depression.
Oh my goodness. So we are really talking about a wide variety there, right? Now, let me ask you this. Probably you have heard this too. Anger turned in is depression.
Yes.
So, if a person is very, very angry, that can eventually become depression. What do you think?
Yes, indeed. It turns into depression at some point.
How does that happen?
It's due to a feeling of guilt,
Okay.
which triggers off anger. Anger leads to frustration, and frustration leads to depression.
Okay, I know there is that anger, frustration hypothesis.
Interaction.
So anger can lead to frustration, and frustration can lead to depression.
Yes.
Okay. And then you talked about relationship issues like breakup in relationships, breakup in marriage, and those kind of issues can also cause depression.
Yes, indeed.
Now, some of the medical reasons like biological factors, some of that can be genetic. So depression can be something that can run in families, right?
By and far, that's the largest category.
Right. Now, have you come across people who are very suicidal? And actually, from my own experience, I have come across suicide as something that runs in families. For example, I'm thinking of a patient right now, who had actually her father committed suicide, and then she wanted to commit suicide.
Yeah, genetic predisposition is one of the major causes of depression.
That may or may not be biological, isn't it? I mean, something probably that she has learned. Maybe that's something that she has learned as a way of coping.
It could be circumstances too.
Right. So
It could be due to a genetic predisposition due to biochemical disorder, like norepinephrine and serotonin
right.
are not delivered at the nerve endings correctly.
All right. We'll go to that. Just before that, I mean, you talked about diabetes, you talked about stroke, you talked about other medical illnesses that can also cause depression. Could you elaborate on that?
Cancer is one of the most common cause of depression. Almost 25% of patients with cancer develop depression.
I didn't know that.
People with multiple sclerosis, people with Parkinson's disease amount to almost 42% of the causes of depression.
Okay. What's the reason for that? Biologically, what's going on?
It's probably the feeling of worthlessness, hopelessness, helplessness, thought of death contribute to depression in these people.
Learned helplessness too, right?
Yeah.
They just know that they cannot come out of it, so they have accepted that condition, and they are becoming depressed again and again. The depression itself is making them depressed.
Exactly.
That's so sad.
There's no way out, and then there's no cure for most of these diseases.
Right.
In fact, if you take the diabetic population,
Right.
almost 20% of them are depressed,
Really?
according to a national study.
Okay. Now, you also talked about neurotransmitters and how those, if they don't get to the nerve endings in the right proportions, right?
Exactly.
And then depression can
Be
be the
more
result, right?
Exactly.
Now, how do you counteract that?
There are a lot of medications available now.
Okay.
In the previous time, when we were in medical school, we had only antidepressants and monoamine oxidase inhibitors.
Okay.
But now we have serotonin inhibitors, norepinephrine inhibitors, and a combination of those two.
So basically, these drugs are available everywhere, right?
Exactly.
They may have different brand names, but essentially
They're
the same.
classified into two major categories:
What are the two categories?
the SSNRIs and the SSI.
Could you explain what those two are?
They inhibit the SSI. They increase the level of serotonin in the brain,
Okay.
and the SSNRIs increase the serotonin norepinephrine uptake at the nerve endings.
Oh, all right. Now, let's talk about the psychological side to this whole thing, right? Um, I know probably there are certain things that we don't have any control on. For example, you talked about illnesses that are incurable, right?
Yes.
But then there are circumstantial reasons too
Exactly.
that we have some control on. And sometimes, like you shared, a lot of times people, when they go through stress, they think it is something catastrophic. They think they can never get out of it, that this is like a dead end. And this is when I think psychology can takes its place, right?
Exactly.
Do you refer people for psychological treatment?
In most cases.
You do?
Yeah.
Okay.
Because psychotherapy forms an integral part
Right.
of the treatment modality.
Yes, yes. And I think of all the people that I have treated, depression is definitely one major category.
Yes, indeed.
Yeah. I see more depressed people than really any other group.
So depression can be mild, moderate, or severe.
Right.
The mild variety lasts a few days or weeks.
Yes.
It's a thought disorder,
Right.
and they need motivation. They need to come off drug and alcohol.
Right.
They need a lot of therapy.
Okay.
They need some dietary modification. They need lifestyle modification, and only then they can come out of this.
I think you mentioned something very interesting. Now, depression can lead to alcoholism, correct?
Exactly.
And actually, alcohol is a depressant.
Indeed.
And so they're getting even more depressed by drinking.
Yeah. It's a feeling that alcohol increases or stimulates your brain,
Right.
but that's a misnomer. It actually suppresses the brain activity.
Okay.
And most of them are nutritionally deficient in folic acid and omega fatty acids,
Right, right.
and that contributes to depression.
Okay. Are you familiar with like herbal medicine or nutrients that can be helpful in getting rid of depression?
As I just mentioned, folic acid and omega fatty acids
Okay.
contribute to,
All right.
and
But in terms of diet, what are some kinds of food that can also be very helpful?
most of the fish varieties,
Oh, really?
tuna, salmon, mackerel,
Okay.
are very well known
Mhm.
to increase the omega fatty acid levels in the body.
Oh, wow. And now, anything on the vegetarian side?
They need to take more proteins,
Okay. What are some foods that will give protein?
like vegetable proteins,
Okay.
like
What
dal.
is high? Dal?
Mhm.
Dal is good?
Dals are full of protein.
Oh, really?
Nuts.
Any study done on this that, especially people who eat a lot of dal have less incidence of depression?
There is a study in India
Really?
by the Psychiatric Association.
Wow. That's very interesting. What else would you suggest? What are some treatment strategies for depression?
Treatment strategy is a combined modality.
Okay.
Drugs, medications, like what I've just mentioned,
Right.
associated with, combined with intense psychotherapy.
All right.
And there was a mention about St. John's wort, as you mentioned, herbal.
All right.
And
What
there
do you
are
think about
various
that?
homeopathic medicines which increase the immune system in the body.
Mm-hmm.
But by and large, giving up alcohol, giving up some drugs, and certain medication can cause depression too, like blood pressure medication,
All right.
sedatives.
Mm-hmm.
These should be avoided
Mm.
to a large extent.
I know you talked about two things. One is medication. The other thing is psychotherapy, right?
Yes.
But we may have people in our audience who really don't have, those kind of conveniences, like a therapist in their town that they can go to. Or they may have some reservation about getting medications too for depression. Is there anything else that they can do out there?
Yes, I think the best part is spiritual counseling,
All right.
family support.
Family support. All right. So families can help them.
Exactly.
In what ways?
By providing them the logical support they need,
Mm-hmm.
like financial or marital relationships.
Okay.
The counseling plays a large role
Right,
in this
right,
kind of depression.
right. I think you mentioned something very important. Even for somebody who is on medication and is receiving psychotherapy, I think a good support system is always very useful.
Yes, indeed.
So having friends around, having family around will be very helpful. And one thing that happens is depressed people have a tendency to isolate themselves.
Exactly.
And so they need to work work on the opposite. Make friends, be in the company of friends, and get more involved socially.
Exactly.
I think those things will help people who are
They
depressed.
need to go out into the community.
Right. Now, you also mentioned spiritual help. Could you elaborate on that?
In my practice, I've found that spiritual counseling
Right.
plays a large role in curing depression.
Do you do spiritual counseling?
Yes, I do.
How do you do that?
First of all, that emptiness in our body or emptiness in our mind is due to lack of interest in a superior power.
Okay.
And I believe in God,
Right.
and I find that you have Christ in yourself,
Right.
you're an entirely new being.
All right.
The old has passed, and all things have been made new.
So you really practice your Christian faith,
I do.
and that helps you.
It helped me a lot.
Mm-hmm.
And I've seen that in the cure of many of the diseases,
Yes.
that people who pray,
Right.
who trust in the Lord Jesus Christ,
Right.
have a better chance of recovery.
Wonderful. Wonderful. I'm glad you're sharing that. Again, this is something that may be new to a lot of people. Okay, they have never tried that avenue, the spiritual side, and how spirituality can really help us emotionally, because they go together. I think spirituality and emotionality, they really go together. They blend. They are complementary. They support each other, right?
Exactly.
So
The
having
Bible-
God in our lives will be our number one solution to any of these problems.
It should be,
Okay.
because the Lord says, "Fear not, for I am with you until the end of the earth."
Yes. Yes. So when did you change like this to spirituality?
Once I became a Christian,
Okay. How long ago was that?
it was about 20 years ago.
About 20 years ago? Okay. Wow.
I've gone through stages of depression, and I find that there's no other modality better than spiritual therapy.
Yeah. We have reasons to be depressed. And actually, it has been said that depressed people are the most realistic people in the world.
Exactly, that's
Because
very true.
They are in tune with what is truly going on around them.
That's true.
While there are just too many of us who are very insensitive, and we don't pay too much attention to what's going on.
And someone needs to reinforce their thinking or thought process. And that's why biblical counseling plays a major role in the treatment of depression.
Excellent, excellent. Well, I mean, if you study the Bible, there were stories of people in the Bible who were depressed, isn't it?
Exactly. In many instances.
King David was depressed.
Uh-huh.
Because in the Psalms, you do sense that in his writings.
I think Psalm 42 quotes that.
Really?
When King David was going through a period of depression,
Mm-hmm.
he cried out to the Lord.
Mm-hmm. So you think crying out to God, praying will help?
It plays a major role,
All right.
and I believe that.
So basically, it's really releasing, the burden,
Your feelings, your emotions.
feelings to God, right?
Exactly.
So through prayer, you release your tension, your feelings, and then you find relief, and that helps you in depression.
Exactly.
Initially, you said, depression is a mood disorder, and that is so true. That is so true. Now, what is mood? If you have to truly define what mood is, what is mood?
It's a feeling.
It's a feeling. It's a state of mind, right?
Yes, exactly.
Differently from affect, right?
Exactly.
Because mood changes, like on any given day we can have so many different moods, right? But affect is something that is more stagnant, like season, it stays
Exactly.
on, right?
That's true.
But one thing is, we do have some control on our moods. We can switch on to be happy or sad. We can change our moods. We do have some control on our moods.
Exactly.
And actually, in therapy, one of the things that I do is train my clients to do that switching. Okay, you are in a sad mood. You walk up. You don't know why you are so sad, but you can, just like turning on the light switch, turn on to be happy. Turn on to be happy. That's a choice you make for yourself. You say to yourself, now I'm not going to be sad. I'm going to be happy. I'm going to have a great day. I'm not going to let this problem ruin my day. I'm going to be happy. So saying to yourself, I think that is turning on, isn't it?
Exactly.
To be happy.
And how can you be happy?
Mm.
Knowing God is the only way.
All right, let me ask you this. Now, knowing that a little more deeply about your theological background, in the Bible we read, rejoice in the Lord. And always I say, rejoice, right? And again I say, rejoice. So that is turning on to the rejoicing mood, right?
Exactly.
So it's a command. You choose to be happy. You choose to be rejoicing. Regardless what circumstances are, what people tell you, and maybe what even doctors would tell you, right? But you choose to be happy.
And unless you believe, unless you have faith,
Right.
there's no way you can hope for the best.
Yes. Yes.
So faith, belief, and hope are three ingredients in overcoming depression.
How do you differentiate between faith and belief?
For example, you have a headache
Right.
and the doctor gives you Tylenol.
Right.
Now, unless you have faith in that Tylenol, your headache is not going to be cured.
Okay.
And you're not going to take the Tylenol and hope that your headache will disappear.
Okay. So having that faith that this tablet will get
The
rid of your
headache
headache.
away.
So that is faith.
That is faith.
Now what is belief?
When you believe, faith leads to belief.
Okay.
You believe that Tylenol is going to help your headache.
Okay. I got it. I think, to me, from what you're saying, faith is really abstract. Belief is more concrete.
Exactly.
Belief is the practical side, right? Faith is something more abstract. It's a concept.
Exactly.
Belief is...
You can have faith without belief.
Yeah. So the belief is the action part of faith,
Faith, exactly.
in that sense, right? Wonderful. And then you said hope. Hope is important too, right?
It's an active ingredient.
Mm-hmm. How do you define hope?
Hope is what you assume your headache will go once you take the tablet.
Okay. And you're going to have a good day, right?
Exactly.
So it's hoping that things will get better. Hoping for a better day. A happier day, right? So that is hope.
Exactly.
So all these three ingredients are so important, one leading to the
To the
next,
other.
right? Mm-hmm. Yes. Oh, well, I wish, through these programs that we are making, that we can help our people to have faith and belief and hope, and that they don't have to give up, they don't have to feel helpless and hopeless and worthless.
Exactly.
Wonderful. Dr. Kumar, thank you for joining me, and it is always nice talking to you. Dr. Kumar has been our family doctor, somebody that we call upon anytime when we have a medical issue in our family, and he has been always a wonderful, caring doctor. Friends, I have 3 of my books here that if you are interested in, please do write to us about these books. I'll be happy to send this to you. If you would like to support this broadcasting ministries, there will be an address on the screen. Please do send your donations and address it to LifeChangers, and we will truly appreciate that. And I hope you will tune in again next time. In the meantime, may God richly bless you. This is Dr. Abraham saying goodbye for now.
LifeChangers, LifeChangers, Life